Groin pull!
What is a groin pull?
Groin pulls or groin strains may occur due to too much stress in the groin or thigh muscles, or more specifically in the adductor muscle. How are they caused?
Groin pulls are caused by muscles being tensed too forcefully or suddenly, causing the muscle to become overstretched or torn. What are the signs of a groin pull?
Groin pulls may include pain and or tenderness in the groin and inner thigh area, pain when legs are put together, pain when knee is raised, or a popping or snapping feeling during the injury that is soon followed by severe pain. What part of the body is affected?
Groin pulls affect the groin area, which may include the belly of the muscle or an area higher up where the tendon attaches to the pelvic bone. What happens if you ignore your groin pull?
If ignored, an acute groin strain can lead to a more chronic adductor tendinopathy, which can prove more difficult to overcome. Which gender is more likely to get a groin pull?
Gender does not affect a person's chance to get a groin pull. Groin pulls are more likely to happen to players in sports that require jumping or changing directions. These are sports such as soccer, football, and hockey. Anyways, how are groin pulls diagnosed?
Doctors are able to find out what kind of groin pull a patient has through two tests. One test involves testing of the range of motion available at the hip. The other test involves a therapist putting resistance on the injured leg and putting it through different ranges of movement. There are 3 degrees of groin pulls. A first-degree groin strain consists of mild pain and a small amount of loss of strength and/or movement. A second-degree injury involves mild to moderate loss of strength and/or some tissue damage. A third-degree groin pull involves severe pain and severe loss of strength and function due to a complete tear of muscle. How do you care for a groin pull?
Applying the Price principles, protection, rest, ice, compression, and elevation as soon as possible after injury is very important. The treatment principles of Price should be used in the first 72 hours of an injury. Protection of the injured groin muscle can be achieved by wearing a groin support, and this will make the injured area feel more comfortable, especially in the case of more severe injuries. The muscle should be rested from all sporting activities in the early stages of healing. A cold therapy and compression wrap should be applied to the area, but for no more than 15 minutes at a time. Elevation of the injured limb should also be done in the early stages, and this is best achieved by lying on a sofa with the legs rested up on 2 pillars. Those with grade 1 groin strains should be exempt from competition or training for up to 3 weeks. 5 days of rest is the minimum amount recommended, but if lack of pain allows, complete rest may not be necessary. A low level of activity may be permitted.
Stretching exercises may be done from day 1 of the injury as long as these exercises can be done without pain. If any pain is felt, it is advised to stop and wait. Stretching should be done regularly during the early stages of rehabilitation. 3 times a day is recommended. Sports massage techniques are extremely useful after the initial acute stage, which is usually the first 48 hours after the injury. This will relax and loosen the muscle, help to prevent scar tissue formation, and encourage blood flow and healing of the muscle. Strengthening exercises are important to avoid re-injuring the affected muscles. It is especially important to strengthen the muscles in the same direction or way that they were injured in the first place. Light strengthening exercises can begin after the acute stage or as soon as lack of pain allows. Exercises can be done on a daily basis during the early stages of rehabilitation. As intensity of these exercises increase and full motion is regained, the number of exercise sessions can be reduced to 3 times a week. However, stretching exercises should be continued throughout the strengthening process. Only when the athlete can comfortably manage specific training and speed work should they be returned to competition. A return to full activity may take 1 to 4 weeks for a grade 1 groin strain. How can I prevent groin pulls?
Groin stretches can prevent groin strains from occurring. Art by Christianne, Castro, and editing by Simbol.